Welcome back. We have three very talented naturopaths joining us today from the Kamloops Naturopath Clinic. All of the ladies in the house today. Sitting next to me, Dr. Tracy Levins. In the middle, Dr. Susan Goto. And on the end, Dr. Sapphire Vanderlip. Welcome to the show, ladies.
Thank you. Thank you.
Yes. So you guys all work together, but you all offer something different. Would you like to start with that, Tracy?
Yeah, so the biggest emphasis is that we are women-run, family-focused. And so we all have a general family practice with different clinical focuses. So for myself, I'm really into women's health. I do a lot of pap and breast exams. We run a thermology clinic, like a breast thermology clinic. Lots of thyroid, PCOS, endometriosis, fertility, so treating females and their partners. So that's sort of like my focus. And then when I was on my maternity leave, Dr. Goto was covering for me. So it was super exciting to have her there. And then when I came back from maternity leave, she was not with us anymore, so she's back. So I'm super excited to have her back.
Good.
And then Dr. Vanderlip has been with us for about 6 months now, and so working alongside her brilliant mind has been amazing. So I'll let them tell you a little bit about their focuses.
So Dr. Goto, your focus is a little bit different than Tracy's then. Tell us a little bit about yours.
A little bit, yeah. So still a lot of hormone work, a lot of women's health, but with the hormones, we also don't want to exclude the guys because they have hormones too. And I'm finding a lot more men these days are interested in testing their hormones and kind of being more proactive about their health. So that's a good thing to see. And also a lot of digestive concerns, skin issues, and a lot of times those two are interrelated as well. And then another area I'm trying to get more into now is pain management. So sort of regenerative injection techniques, so sort of as a less invasive alternative to surgery to help people kind of manage their chronic pain.
Fantastic. Dr. Vanderlip, you then again are different from these two.
Yeah, in some ways. So yeah, I treat general family practice, so like from infancy into the elderly. I treat a lot of kids, so a lot of digestive issues, skin stuff like eczema and acne, focus, energy, cancer, autoimmune disease, and hormones. I mean, there's so many hormone problems these days. So
yes, it seems like more than ever people are wanting to get in tune with the, what is going on with their hormones. I know there's a surge with women. It's interesting that you mentioned men as well. Why do you think this is, Tracy?
I think that women, well, women in particular, but Susan can talk to you, the men part of it. There's a lot disrupting our endocrine system, like in our environment now with our food, with things that are in the environment. Stress is a big part of it. And so we're experiencing, hormonal changes a little bit heavier, I think, than we used to. Women are more in tune with their bodies. They don't want to accept not feeling hormonally balanced. They're looking for more answers. They know that they can feel more optimal. So they're seeking us out to do the testing and to really get to the root of what's going on and to go through like transitions or figuring things out for fertility a little bit easier.
And there are solutions out there should things be out of whack, and I know they are for many people.
Yeah.
And for men?
And I think for both women and men, I think people are realizing more and more that how much of a role hormones have in their overall health. It's not just the sex hormones. It's your adrenals, your thyroid. And so if you're feeling fatigued, if you're not sleeping well, if your mood's off, all those are hormone related.
Fantastic. So you guys really offer such a wide variety of different types of ways to sort of look at yourself, but to get treatment. Do you find more people are coming to naturopath now than they ever? Like Western medicine's always going to be there, but we also have a shortage of doctors. I won't lie. We're very aware that somewhere within the 20 to 30% group of Kamloops, a percentage does not have a doctor. Do you find people are more coming to alternative medicine for that as well?
Yeah, 100%.
Yeah.
And that's kind of what we're putting ourselves out there for. We're general family practice with clinical focuses. But we are accommodating people that are not having, like Western medical doctors. Some extended health plans do cover us. Our clinic's getting into direct billing, so that makes it even easier for people financially to come in.
Sure.
But we are seeing an influx. Yeah.
So depending on what your situation is, you can phone and say, my situation is skin and digestive, for example. I've had that problem. You can phone and say, okay, we'll put you into with Dr. Vanderlip, sort of thing. And then you guys sort of feel out who would be the best doctor.
Yeah. And we
Yeah.
also do like 15-minute complimentary visits. And
Nice.
so if you think that Dr. Vanderlip would be a good fit with you, then you can sit down and sort of have like a little bit of an introduction with her and make sure that that's good.
It's
yeah.
a good fit.
Yeah.
Yeah.
We're also sort of trying to get into more of a collaborative approach where,
Yeah.
you know, you might be seeing one doctor, but if you have new concerns come up that maybe fits in better with another doctor's specialty, then you can consult with them as well.
Sure. Yeah.
So you kind of have a team working for you rather than just one person.
That's awesome. Impressive that you guys are all under one roof, ready to help people with their situation. So fantastic.
Yeah, thanks.
Great to have you all on today. We want to make sure you know how to get a hold of these folks because they definitely have a lot going on under one roof. The website is on the screen, Kamloops naturopathclinic.com, along with the phone number and the address. They're on Seymour Street. We are back after a quick break. Stay with us.